Hi, I'm Glenn Brooks. I want to welcome you to Beyond the Formula and Unscripted Power. They're kind of married. So, boy, dentistry. What does dentistry have to do with mastery? Many, many years ago, I did a course called the Mastery Course. And the psychiatrist traveled on the world with one question. What is it that leads to mastery? And what he meant by mastery was people that seem to lead their field, produce results that no one else did. Who were they and how did this occur? My experience for a good chunk of my life was that I couldn't find it in dentistry, and I shared this with the public, and a lot of people responded, and 2 national magazines. And I'm going to do this series. I'm going to call it for now a new breed of dentist, a new breed of dentistry, because there's so many things to learn. So I want to introduce you. First, I want to say a shout out to my beloved co-host and producer Rose Rivera, whose curiosity and sense of wonder and sharp awareness always contributes massively to what we're doing on Beyond the Formula. So, Rose, good morning.
Good morning, and thank you for that introduction. I am so excited for this show because, like you said, I think dentistry is one of the most misunderstood, vaguely fogged thing that's in our life. So I'm pretty excited to bring some clarity to that and make it not so scary.
I'm so happy you say that. I'm so happy you say that. Yeah, most people like you, they hate the dentist or they have to do it, or they're suffering from the consequences of doing it. And everyone, maybe 1 in 300, they're somewhat happy about their dentist. So Dr. Saul Pressner, he's the international president of the Biomimetic Dental Association. He does dentistry based on the laws of nature. As soon as I heard that, I felt more harmony. And the recommendation, how I got to Saul was through Dr. I totally lost his name, Saul.
Nicholas Gonzalez.
Nicholas Gonzalez. So thank you. That was very powerful how you did that. I always like you cover my back now. Yeah, Dr. Nicholas Gonzalez, world-renowned oncologist, nutritionist, who I met through a pretty amazing model who life got turned around. Anyway, me and Saul, the first conversation we had was about dentistry. Funny enough, because he asked me what I thought about these dentists in the New York area, and I said I wasn't happy with any of them for my research. And he says, you know what, I'm going to call you and tell you about a dentist that does dentistry by the laws of nature. So on our first show, our regular show, Saul will always be a co-host, and we'll be discussing the bigger topic of how to access a different world of dentistry, how to deal with your fears, and some things that you'll discover that you won't find out at your dental office. So Saul, so welcome. So happy you're here.
Thank you so much, Glenn. I appreciate it. Thank you.
So I'm always curious when someone has a certain level of mastery and they come into it, usually they have to stretch beyond the conventional. They have to be very curious. How did you discover a different world of dentistry, or how did you come into this different understanding of dentistry?
It was about, say, 30 years ago. I started studying with a dentist named Ray Bertolotti, who still lectures and teaches all over the world. And he talked about adhesion and how we can better place restorations in a more conservative manner. He talked about how you don't need to file teeth down for crowns if part of a tooth breaks. Instead, you can build the tooth back up with modern adhesive technology and based on the latest science. So it intrigued me, and I ended up taking a lot of courses with him twice a year. He practices outside of San Francisco. And then he led me to another gentleman about 10 years ago named David Alleman, who practices in Utah. And David Alleman termed the phrase biomimetic dentistry, mimicking life. And Dave Alleman took it one step further than Dr. Bertolotti did, basically preserving tooth structure in a very tooth-conserving way, preventing bacterial contamination, better sealing the tooth against bacterial invasion, and preventing crowns and preventing unnecessary root canals. And he talked about the cycle of tooth death. So conventional dentistry, which most dentists have been taught in dental school, if you break part of a tooth, we were taught to file down the rest of the tooth for a crown to protect the rest of the tooth. But by doing that, you remove the strength of the tooth, the enamel. And by doing so, you put the nerve at risk, often necessitating root canals. Teeth that have had root canals are much more susceptible to catastrophic fracture. You end up losing the tooth and you end up needing an implant. So this whole concept intrigued me, and I felt it was the right thing to do for my patients and for myself in my own mouth. It's what I'd want. So we formed an academy based upon Dr. Alleman's studies about 7 years ago, and we have conferences every year, and we have other continuing education sources on our website to train dentists and educate the public about the merits of this kind of dentistry, basically. So that's where I'm at.
You know, I want to say, Rose, as Saul speaking, it's because of my own challenges around dentistry, I've had a chance to talk to hundreds, if not thousands, of dentists. And interesting, what Saul just said was so powerful, because think about what Saul just said. You get your crown, you get your root canal, and what happens often with dentistry, it sets you up for more dentistry, right? So you get the crown, and all of a sudden you're sacrificed. And if you look at a lot of websites, which I have, and I've talked to tons of dentists, it's almost a given assumption that you're going to need work that is probably going to set you not just for more work, but also probably jaw distortions, you know, jaw pain. So the intelligence of what Saul just said was, and this is not on any websites. What's on websites, when I talk to dentists, a lot of times, they talk about the whitening of teeth. They talk about catering to cowards. I always think we're incredibly smart people, but we're not cowards. We're actually smart. So it's just interesting if you just have that little bit that Saul said, Rose. I'd love to get your take on how that impacted you.
Yeah, a couple different things. I particularly love that it's building on new science, and it's building on things that we already have in our biology, that it's not actually fighting against our bodies, but really working with them, which hopefully is where a lot of health is going in all the different fields. So to hear it come through in dentistry is very exciting to me. And also, I think it brings a little bit of the fear factor down. To hear a dentist say, you know what, we're not going to do a root canal, and we're not going to file down your teeth. We're not going to do all these things that a lot of people go, oh, I'm not going to the dentist, because they know that's what's coming. So that's what came out for me personally that I really enjoyed.
Good. Well, I'm glad. Good. Good. It's also less expensive for patients. It's less expensive in their lifetimes because they get to preserve their teeth, and they will need less invasive work in the coming years. It's just much better, and it's less painful. It's just better for the patient. So that's why it really means a lot to me to do that. So.
You know, I was on the phone with, I'm building an amazing advisory team, not just of dentists, but hypnotherapists, doctors, people really concerned in this, and who are philosophically are very aligned with this approach. And I was talking to a dentist in New York, and one of the things that we were talking about is this one learning institution that dentists go to, and their ideal mouth would be these certain looking teeth where they have to basically, this is the interesting thing, you could pay $150,000 and get what they call a cosmetically perfect mouth. The question's not about how is that going to impact your tongue, the function of the rest of your body. So it's like we got to think of the mouth as having this interconnection with the rest of the body, and that's missing in a chunk of dentistry. And I was surprised again that people spend a lot of money when they hear this term cosmetic and not think about the long-term consequences. And also, do they need this much invasive work?
They usually don't. Unfortunately, the way our society is, you know, we have these idealized images of body type and smiles and whatnot. But in order to sometimes obtain these in the mouth, a lot of destruction of tooth structure has to occur, unfortunately. And there are better ways to do it. There are more conservative ways to do it, which preserve your teeth and preserve the health of your teeth, in my opinion.
You know, Rose, I don't know about you, but early on, Rose and Saul, I guess I went to the dentist because I had to. My parents forced me to go. We weren't going to the music park. It wasn't a bar mitzvah. It was a dentist's office. Usually it was unpleasant. I remember I was in an oral surgeon's office a few years ago, and it was like everybody looked like they were in straitjackets. They looked so tense. And so what's interesting is, if you think about this, someone's inside your body. They're it's not like you're just going to buy, I don't know, a dress. It's kind of, you're in this office, and a lot of times the human factor is totally negated, right? So most of my experience of dentistry was being in a movie later in the day with my mother in great pain. That was my earliest memories, was being in pain and hearing I needed yet another invasive procedure. And I only wish, I mean, what Saul just said, it's like, I wish my dentist would say, you know what, we're going to do stuff that's gentle for your body. Tell me their name. Pretty much, it was never like that. It was, I strap on the apron, and all of a sudden in my mouth. And they're discussing how much it's going to cost. And I'm like, where am I in the equation? What was your first experience like, Rose?
Well, I think it was more pleasant than the one you're describing.
Yeah, I don't recommend that guy.
Yeah. No, I mean, I went to very traditional dentists when I was young, but I do remember my mother had a big fear of going to the dentist. So she made it a point when we were all little, I have two brothers, that she took us to the dentist every 6 months to get cleanings, because she said, I don't want my children to have a fear of the dentist. So she actually found, I mean, a really nice dentist, and I only had good experiences. But I think I told you this story actually, Glenn, is when I was in high school and I moved to Connecticut. I grew up in the Virgin Islands, so that was my first experience down there. And then when I moved to Connecticut, they did the x-rays. The first thing he told me is, you have to get all your wisdom teeth out because they're all impacted, right? And I said, well, why? Why? And he goes, well, it's just what we do. We just take them all out. And so I said, but they're not even bothering me. And he goes, well, there is a risk that later on it could get infected and all of these things. So I just flat out said no. And then he told me that they would have to do some surgery through my ears to get to my teeth. It was craziness. And I was just like, when they start bothering me, if and when, I will deal with that problem.
How many years ago?
Oh, I was 16. So I don't know, however that is, quick math, like 14, 15 years ago.
Yeah.
And, you know, and I still have family members that have all of their horribly impacted wisdom teeth and they're in their 60s and they're fine. So I think that's the kind of thing that really turns people off from going to the dentist. It's like, no matter what happens, even if you think your teeth are fine, they're going to come up with something, something like horrible, some kind of surgery that you have to have.
Yeah, yeah.
So what I love about this is the health.
Invasiveness at all levels.
Right, exactly. Exactly. So I really love Saul's approach and the idea of bigger health. And, you know, since then I've learned how interconnected the mouth is with the rest of your digestive system and your health and your body. So if we could just touch on that for viewers that haven't been exposed to that sort of material, I'd love to just spend 5 minutes getting into that connection.
Sure. Well, basically, biomimetic dentistry, since it is more conservative in its approach, you're filing down less tooth structure. You're impacting the nerve tissues of the teeth less, so that we are more likely to maintain the vitality of those teeth. So every restoration we do is reducing less tooth structure, and we try as much as possible to keep the interface between the restoration and the tooth above the gum line, so that less bacteria and plaque form at the gum line. There's been, as you both realize and viewers may realize, there's now a lot of evidence linking good oral health to good overall health. If we reduce less tooth structure, impacting the nerves of teeth less, necessitating less root canals, and placing the margins of restorations above the gum line as much as possible, then there's less likelihood of bacterial invasion into the bloodstream. Traditional crown and bridge, which we were taught in dental school, where you file a lot of the tooth structure down, we were taught to place the margins of these crowns under the gum line so you wouldn't see the margin. The margin would not be visible. What happens with that is that more plaque accumulates at the interface between the crown and the tooth, resulting in more bacteria accumulating in that area and resulting in more gum inflammation. And eventually what happens is when you place a crown margin under the gum line, the gum recedes anyway. So several years down the line, you may very well see that margin visible. So by burying the crown margin under the gum line, not only are you risking more bacteria accumulating at that interface between the crown and the tooth, because there's always a gap between the crown and the tooth. It could be as little as 30 microns, but there's still an opening there where bacteria can colonize. But by doing that, it's kind of a lost cause because the gum will recede anyway. Plus, if you're not impacting on the nerve of the tooth as much with a more conservative approach, then you're less likely to need a root canal. If you're less likely to need a root canal, there's less of a likelihood of the tooth fracturing and being lost and needing an implant, which is a much more invasive procedure. So biomimetic dentistry or tooth-preserving dentistry is much better for your overall health because you're really preserving your dentition in greater health. And that impacts on your overall health as well, basically. So that's the best answer I can give you. So.
I never thought I would love a conservative approach so much. It's not.
Well, we're not talking politics.
I know. It's really funny because I think how I came. So the first famous book that was written on dentistry for people who question dentistry was a book called The Tooth Strip. It was 1970s. Wrote this book, and it was kind of like for people who kind of thought about all these things that would happen with dentistry: accessibility, finance, like pain. It was kind of a funky book. Now I think his new book is called Dental Wellness, and I thought this was interesting. A lot of people have this experience. A lot of people's insurance don't pay for dental. It's always been a dilemma. And another dilemma is how the heck do you find a good dentist? That's a huge dilemma. So I also decided to find people who are body workers, understood the body, and things like from rolfing to different types of massage to cranial osteopathy. What Saul just says is just so, I just want to say, Saul, you're getting more brilliant at communicating the message simpler and accessible, because it's like, so 4 years ago, I go to this dentist in Boston. She's very highly recommended. And she files down my teeth, all my front teeth. And I just didn't think of it. I didn't have the education. And she's supposed to be one of Boston's finest or whatever. And she's supposed to have this natural orientation. So I wasn't blinded. I did have some education. I was in the chair about 4.5 hours. And yeah, I had a smile again. And she explained that you do the front teeth because that's where you start. She explained it to me. Now, I was eating a piece of chicken probably 2 months later. It shattered all of it. And, of course, what I had was these little stumps. And I realized, oh, yeah, after meeting Saul, it was like, yeah, that's what happens when you have crowns. You got to ask yourself. I mean, in some ways, it's such common sense. That's the thing. Like, when Saul he says what he's saying, it's kind of like, wow. It's like, but yet you go to most sites. It's like crown. We do great crown work in one day. We got this $100,000 computer, call it a CIRAC. And they're all bragging about crowns. So this is another side of the story. We're going to share resources. We're going to have other people on. We're going to have other biomimetic dentists on, other dentists who share this philosophy so people can have some sense when they call a dental office. Because this is, if I go to any phone book in the country, I go to the internet, this is not a discussion. This is just not a discussion.
I mean, when dentists were trained years ago, including myself, we didn't have the adhesive technologies and the science that have improved dental adhesion, so we're able to do these more conservative procedures. And a lot of dentists are still caught up in that old paradigm. But now we do have these newer paradigms, and you can save teeth and preserve tooth structure much more predictably, which is better. So.
I became friends with a dentist in Williamstown. I got him on the front page of his newspaper. He had a $100,000 laser, and he lasered my gums. Now, in the old days, this procedure I probably would have taken 2 weeks with stitches, and I couldn't be able to eat. Pretty much after that treatment, I could eat the same day. I liked him a lot, but he really didn't understand. He still didn't understand this. So he gave me a root canal, and sure enough, it failed. And when it fails, it's incredibly unpleasant. It's like it gets infected. They got to go in there again. You lose the tooth. And so I went through so much of that kind of dentistry. I never understood, there was no underlying philosophy, even on many so-called holistic dentist practices. As a matter of fact, a lot of these guys could be much more invasive. So after all these years inquiring and speaking to people, this philosophy, this conservative tooth-saving philosophy, was like, wow, it just seemed like someone thought about it. You know, so you didn't get to these other things. You know, you're not behind the eight ball. Because a lot of dentistry is we're reacting to one thing, and we need to react to it now. Right? And reacting to it now, and we're setting up, what are we setting up now?
Correct. That's true. And it's part of the problem is also these things are not discussed with the patient in terms of what the risks are down the line, the consequences of the treatments. And that's unfair. I mean, and dentists really, physicians also, we always have to present all possible alternatives and all sequelae to what the results are of our treatments. And that, as a patient, you have a right to know that.
30 seconds, a quick story. I go locally to get my teeth worked on. I met this patient in Pakistan. And I usually don't even need Novocaine, but I did that day. The other physician said, get Novocaine. And I totally forgot about my relationship to epinephrine, which is in a lot of these Novocaine shots. Saul and Rose, I felt like having the worst panic attack of my life. I had to think in my mind, Glenn, this is going to pass. Glenn, this is going to pass. I walked around the block 15 times and it passed. It was terrible. They had no cognition of this, by the way. None.
Yeah. Epinephrine can do that. I mean, epinephrine has its place, but certainly if it's going to be used, you have to warn the patient and find out if the patient's had a reaction to it in the past.
No warning.
Yeah.
Just a bill. No warning, just a bill. Could have been the name of the practice. Just a bill, no warning.
Right.
So this series is going to be ongoing. We're going to have people on from all around the world. We're going to really not just educate, but inspire you, and so you have your eyes open. Because, you know, just one distinction. Imagine if today you knew the distinction. You always thought a basketball was a golf ball, and then you realize, wait a second, a golf ball is different. I want to make it that simple and accessible, because that's what mastery is. And we'll also discuss non-invasive methods, and we'll educate you. You can write to us. You can be in touch with us. We'll have dentists around the country. I want to share stories, too, of people who have given up on dentistry. They've just given up. They've had it. I want to get these people on who've had good success. And Saul, it's just great catching up with you.
Glenn, thank you so much. It's my pleasure, and I think you're doing great work and a great service to the public. Thank you.
Thank you. I'm going to do the impossible. Make dentistry interesting and make this profession someplace you're eager to go to, and there's no lost causes, and we're going to share with you a different approach. I appreciate you tremendously. Thanks very much, Dr. Saul Pressner.
Thank you so much. I appreciate it. Thank you.
Thanks. And Rose, one word from you.
I'm very excited to get into this whole series because I think we've just scratched the surface today. Especially for me, it's always about this idea of bigger health and how to integrate this into your life in all ways. And I think people really downplay how important the mouth and the teeth are to just overall health and well-being. So I love Saul's approach and what he's doing. So Saul, if people want to get in touch with you, why don't you give out your information real quick before we go?
Sure. My office number is 212-249-8999. You can email me at saultooth, SAULTOOTH, at AOL.com. My website is www.newyork-cosmeticdentist.com. But I don't just do cosmetic dentistry. It's an old website name. And if people are interested in biomimetic dentistry, they can also visit the Academy website. It's www.academyofbiomimeticdent.org. And any questions, feel free to call me at my office at 212-249-8999.
We're going to send you a copy of this for you to put up on your website and let everybody on each show. We're going to point them towards your website.
Oh, thank you.
We want a lot of people to know about this. We have Dr. Gary Epler on from Harvard today. He's going to love what you do. Isn't it interesting, Rose, that part of Saul's last name is Tooth? I think that's interesting. I just noticed that today. First time I
was born to be a dentist, you know?
I know. I mean, what a giveaway. God, I wish I knew your parents, how they came up with that last name.
I don't know. It was Bichette.
Yeah. Well, appreciate you tremendously. Thank you, Saul.
Thank you, Glenn.
On again and again, and we've only just begun. Thank you.
Thank you, Glenn. Thank you, Rose. I appreciate it. Thank you again.
Thank you.